Joining me now is Dr. Anthony Fauci, is of course the director of the National Institute for Allergy and Infectious Diseases. Dr. Fauci, welcome back to Meet the Press. Before I get into some of the specifics, I just want to give you a chance to take a step back. A death toll of 500,000. We're basically at the 1-year mark of this pandemic. And you think about it and compare it to what this nation faced in 1918, and we have modern medicine today. Just how deadly in the big picture has this pandemic been in this country?
It's stunning, Chuck, horrible. I mean, if you look at what has gone on now, and we're still not out of it, 500,000 deaths. It's terrible. It is historic. We haven't seen anything even close to this for well over 100 years since the 1918 pandemic of influenza. It's something that is stunning when you look at the numbers, almost unbelievable, but it's true. This is a devastating pandemic, and it's historic. People will be talking about this decades and decades and decades from now.
No, I think there's no doubt about that. All right, let me get into some nitty-gritties. How much of a setback did we take this week with the winter weather and vaccine distribution, and how long will it take for us to catch up?
Well, first of all, obviously it is a setback because you'd like to see the steady flow of vaccine getting out there to get into people's arms. But we can play pretty good catch-up. We're already down now. We've gotten 2 million out, so it's now 4. You know that the number was 6 million doses got delayed. We've gotten 2 million out, and we project that by the middle of the week, we will have caught up. So it's unfortunate that it was a setback. But, Chuck, it's a temporary setback, and when you just, put your foot to the accelerator and really push, we'll get it up to where we need to be by the middle of the week.
All right. There's you and I have had conversations about the first dose versus the second dose a couple of times now. We've gotten another study out of Pfizer having to do hearing more about the first dose, particularly for folks that have had COVID. Any of these new studies giving you any sense of where we would change our vaccine distribution schedule? Make it where we're 12 weeks for everybody or 6 weeks for everybody? What of these studies is giving you any sense of whether we should change these protocols?
Well, Chuck, I think the people need to appreciate the view is there are really two very different scenarios that you just painted. One is if you've been infected and you get vaccinated after that, what about one dose? The other is if you've not been infected and you get one dose of Pfizer, can you get away with one dose or prolong the second dose? And I would still maintain that there are enough unknowns in that, particularly the durability of the protection. We know from studies that we did that antedated and led up to the very, very impressive results with the 94 to 95% efficacy with both Moderna and Pfizer, that when you give a boost, you increased the power or the level of the antibodies by at least tenfold. So you're talking about a very, very big increase. We don't know what the durability of a single dose is, and it really is risky for lack of protection and risky to engender perhaps some variants. With regard to following infection, that's a different story because the data look really quite impressive that if you've been infected and then you get a single dose, the boost that you get with that single dose is really enormous. So we're looking very carefully about that. And that is one thing that you might want to consider. But we want to really carefully look at the data first. But those are two different scenarios. You don't want to confuse them.
And I was just going to say, so let's say you see the science and you feel good about this, about if you've had COVID, one dose may be enough. I'm just curious, logistically, what would that mean? Would you have somebody would have to come in and show proof they've had COVID? Is that something, or they would be tested there for antibodies? I feel like that's the one gap here that would complicate it just logistically.
Right. Well, that's the reason why I held back, Chuck, in saying, yes, let's recommend that. You've really got to look at the science, look at the data, and figure out what's the best way. The obvious one that you think of is the documentation that if you do an antibody test and it's very clear that this person has been infected, that then you could be reasonably comfortable that you're dealing with someone who is post-infection. But I would reserve any kind of decisions about that until we very carefully looked at the data. But it is really quite suggestive. The data were really impressive.
So this is something you think could be something that in 4, 6, 8 weeks, something like that, we could change protocol?
Well, you know, again, I don't want to get ahead of the decision-making process on TV, but I think it's quite reasonable from the data that we've seen that you want to take a good look at it because the data are impressive. I
want to ask you about pregnant women because I've had a lot of viewers ask me to ask you about this because there's some confusion. We know Pfizer's studying it. I've talked to other experts who said, hey, you know, pregnant women should get vaccinated. They shouldn't fear this vaccine. What say you?
You know, the issue is that pregnant women, we have not been formally tested in a trial for safety and efficacy. That is being done now. We will get an answer for it. However, following the EUA from both Moderna and Pfizer, thousands of women have elected to get vaccinated despite the fact that they're pregnant. Many of them were actually healthcare providers who felt that the risk of COVID on their pregnancy was far greater than the risk of the vaccine giving a deleterious effect. And as a matter of fact, right now we don't see any red flag signals among those thousands of people who have gotten vaccinated while pregnant.
Let me move to schools. Based on the CDC guidelines, what level of risk is an unvaccinated teacher taking right now by going into a reopened school?
You know, Chuck, you cannot give a numerical figure to that. You can't say what is the risk. Give me a number. I mean, obviously, being in school is very similar to being in the community. So the risk of a teacher getting infected in the school is very likely very much similar to what you would see in the community. But we don't know that yet. You see, they haven't done those kind of prospective studies where you can quantitate and make a decision based on this number is here and that number is there, because the data get fuzzy when you try to compare what happens when you're not in the school versus when you are in the school.
Well, you understand why there's just this, it has caused this consternation, right? The scientists say, hey, look, it is relatively safe. Obviously, a teacher sits there and says, yeah, but I'm still taking risk. And I know you don't want to wade into the politics of this, but this is where, would you feel comfortable going into a classroom and teaching?
Would I feel comfortable? You know, it's tough because I've not been in that situation. I could tell you I have a daughter who I adore who is actually doing just that right now as we speak in a city far from Washington, D.C. So, I mean, I understand the concern that people have, and that's the reason why we say, Chuck, you know, when you ask a question, a specific question, it's appropriate and it's understandable, but there are so many complicated issues. How the teachers feel, how the parents feel about the possibility of bringing infection back home. There are so many things there that you need to consider. The thing that we say, and Chuck, I've been saying this for months and months, even antedating the CDC guidelines, is that the default position is that we should try to do everything we can to get the children back to school safely for the children and safely for the teachers and other educational personnel. And the CDC guidelines try to delineate the steps where you can do just that. How do we get them back to school in a safe way, and giving a couple of the guidelines, more than a couple, several of the guidelines of how you can do that. And it's not an easy issue, Chuck. Anybody that says it's easy decision to make, they're not looking at the complexity of it.
Yeah, human beings are involved at the end of the day. I want to leave on an upbeat note here. We've had cases come down dramatically. And this is after what some people feared might be a holiday spike or a Super Bowl spike. We're not getting that. One Johns Hopkins scientist argued in the Wall Street Journal, this means herd immunity is coming even faster than perhaps folks thought. What say you to that?
Yeah, I'm not so sure that this is herd immunity that we're talking about. We had a big peak and we're starting to come down. Certainly, the number of people that have been infected are contributing to that. Also, some contribution with vaccines. Not a lot. I don't think we've vaccinated enough people yet to get the herd immunity. I think you're seeing the natural peaking and coming down. The one comment I want to make about that, Chuck, for the viewers and the listeners, is that the slope that's coming down is really terrific. It's very steep and it's coming down very, very quickly. But we are still at a level that's very high. What I don't and none of my colleagues want to see is when you look at that slope to come down, that it say, wow, we're out of the woods now, we're in good shape. We're not, because the baseline of daily infections is still very, very high. It's not the 300 to 400,000 that we had some time ago, but we want to get that baseline really, really, really low before we start thinking that we're out of the woods.
So keep wearing your masks, everybody, at a minimum. Anyway, Dr. Fauci.
Absolutely.
Yeah. Anyway, I will.
I'm glad you said it, Chuck.
We will scream it as much as we can. Anyway, as always, sir, thank you for coming on and sharing your expertise.
Thank you for having me, Chuck.
Hey, thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.